Hello, my name is Craig Warden. I'm Executive Vice President with Polaris Strategic Insights. We were commissioned by the Ontario Association of Optometrists, the OAO, to conduct a membership survey on their behalf, and I'm very happy to be able to present it to you through this slideshow. A few words about what we did and how we did it. This survey took a very singular focus almost in terms of looking at members' views and preferences about the recent 2017 provincial budget increase to the OHIP optometry envelope. The way we did it was an online survey of members that was conducted between July 6th to July 28th in this past summer of 2017. The way the survey was conducted was the OAO issued email invitations to all members, roughly 1,600 members. Within that email invitation that everybody received was a unique link that could only be used once for each member that would take you to our secure survey servers, where you could then participate in the survey. In total, 674 members participated in the survey. That's roughly a response rate of 42%, which in the world of membership research is very good. Our company has done well over 100 membership surveys in our time, and I myself, during my career, have done membership surveys in the amount of well over 30 or 40 different projects. And these days we're seeing response rates in the range of 20 to 25% for a membership survey of this type. And so getting a 42% response rate is very good. Looking at the statistical reliability of this sample of 674 members, it carries a margin of error of plus or minus 2.9%, 19 times out of 10. So a strong level of reliability here. Couple that with the fact that we see just some strong consensus on a lot of the questions. These are some very reliable results for you. We should also mention that the results came in terms of the members that participated in this survey. They came in very proportionate to the actual demographic and regional distribution of your actual membership. So the people who comprise this data set, this sample, they are not overly skewed to one demographic, to one age group, to one gender group, to one region. In fact, we had to weight the data very little to have this data set accurately reflect your demographic and regional distributions. It's a remarkably proportionate data set even before we weighted it. So these are very representative and reliable findings. So I'll take you just briefly through an executive summary of some of the key findings, and then we'll dive into the detailed results. As I alluded to, this is a remarkably cohesive set of opinions in this data set. The membership is offering us some clear, widespread consensus on most of the issues that we asked them about, and where we asked them to provide us with additional suggestions or policy preferences that we may not have covered when we designed the survey. Most, in the range of 7 to 8 in 10 participants, most said that they didn't have any additional suggestions, that their policy preferences were covered in the questions. Sort of taking us through some of the questions that we asked, overall, increasing compensation for existing fee codes is overwhelmingly the top priority for members. And this is followed by strong support for increased compensation for requested reports. So that's the reports that get requested by GPs and nurse practitioners and the like. We also tested a new urgent care code as a possible option that the increase to the OHIP optometry envelope could be devoted to. This receives clear majority support. It trails the support for existing fee codes and investing in increased compensation for reports, but it is a clear majority support, roughly 2/3 are supportive of this as well. Near the end of the survey, we get into future advocacy initiatives, and in that section, you'll see that almost all respondents intensely support advocating for a mechanism for annualized increases to OHIP compensation. Most also support removing refraction as a required insured element of the V409 code. And when we measure priorities and preferences for future advocacy initiatives, sort of asking respondents to give us some priority rankings, the mechanism for annualized OHIP increases is clearly the top priority. It's followed by changing the V409 code to be based on clinically significant or medically necessary cases. And a tertiary priority is obtaining clarity on uninsured services. Some context questions began the survey, and in many ways we ask these questions at the start of the survey so that we can then ask them again at the end to see whether or not opinions have changed. So we start with asking optometrists, your members of the OAO, whether they feel that the provincial government is on the right track or the wrong track on three key factors. One, governing the province overall, managing healthcare, and managing eye and vision care. And you can see here some very consistent results across the board. 70% feel that the government's on the wrong track on all three factors, with a third or more feeling strongly in this way. Very few give us a right track score for this government, and those would be the blue bars over on the left, with no more than 18% giving a right track rating to this government. When we ask them to assess the overall quality of eye and vision care in Ontario, we see a more positive rating. We see 76% provide a good rating. This is moderate. You can see 56% saying good, only 19% saying it's excellent. And in the previous slide, you saw that they're rating the government's management of eye and vision care. Here, optometrists are talking more about specifically about the care that Ontarians are receiving from optometrists. And here they provide a positive rating, a moderately positive rating. And we asked them to consider whether or not if the OHIP fee code increases were frozen over the course of 2017 and 2018, whether or not that would lead to an increase or a decrease in the quality of care based on maintaining these codes as they are. And you can see here that 63% feel that this would result in a decrease of the quality of care, of eye and vision care, a moderate decrease, with 47% landing in the moderate decrease column and just 16% feeling it would be a major decrease. Still, overall, a decrease, 35% are sort of neutral, and only 1% think there would be an increase. And how familiar is the membership with this increase to the OHIP optometry envelope in the 2017 budget that was announced just this past March? Well, here we get some interesting findings. 10% tell us that they are very familiar, that they know a lot of the details about this. 36% say that they are moderately familiar and know some of the details. 46% tell us that they are aware of it, but they don't know any of the details. And 9% are completely unaware. So that gives us an overall awareness rating of 9 and 10 optometrists who are aware, but less than half are actually familiar to some degree, and mainly to a moderate degree. Just 10% are highly familiar. So that gives us the context for some of the findings that you'll see as we go forward. The first option, sort of an investment option or an allocation option for this budget increase of $15 million or 10% over the last, The first thing that we delved into was the possibility of introducing a new urgent care code. The reason we dealt with this first is because it is a new idea that we have to define before we can put it up against the other options when we do some trade-off testing later. So initial first blush support for this idea of a new urgent care code, you can see it described down below in the gray box. When it's presented as it's defined there, first blush initial support is 51% support. So you do get a slim majority, basically half supporting it, 40% opposed. Notably, that 40% tends to be more intensely opposed than moderately opposed, whereas the supporters are sort of split evenly between intense and moderate support. And that's what you get to start. Now, what we did from this point is we then introduced some different elements that could be added to this definition or to how this new urgent care code is defined. And they're listed here. For each of these, they are presented, and the membership was able to tell us whether they support or opposed each of these options. And in particular, they were able to tell us whether each element was mandatory to them providing support. You can see here in the dark blue bar, the dark blue bar represents those who say that they would support an urgent care code with this element as part of it, and that it would be mandatory for them to provide their support to have this element as part of it. So that's why that bar for us is the most instructive. The rest of the blue bars add up, and provide us the total support, whether it's mandatory or not. But for us, what's most telling to us is what is deemed to be mandatory and how many people feel it is mandatory. So when we go from the top down, you can see that the introduction of this fee code not preventing an increase in compensation levels for other fee codes is one of the key elements that should be part of this new urgent care code in order to get 50% to provide their support. This has to be a mandatory element for that 50%. Another 46% are saying that it is mandatory that optometrists determine the eligibility for OHIP coverage, that it would only be provided for conditions that the optometrist diagnoses as an acute urgent condition. That is mandatory for 46% to provide support. 44% feel this way about having compensation levels that are reflective of the level of expertise and the true value of services rendered. And 41% say that it's mandatory for their support to have additional mechanisms to bill privately for related supplementary services. Now, looking at the bottom two elements that we tested, these I would term negative elements, whereas the top four are positives. You can see the bottom two, it's, the government might cap fees if the code is overutilized. The government might reduce fees if the code is overutilized. Here we have very clear opposition, 59% opposing an urgent care code if there's a possibility that the government could cap fees if it's overutilized, and 69% opposing it if the government might reduce fees if the code is overutilized. So clearly those possibilities, when raised, do conjure opposition amongst the membership. Now, after testing all these different elements of how we might define an urgent care code, a new one, we then asked the membership if the new urgent care code met all of their mandatory elements. Now would they support or oppose it? And here we have very clear support, 66% support. And in my business, where we test a lot of policies, whether for government or for those wanting to influence government, getting to 60% or 2/3 support like this is what everybody's trying to get to. It's hard to get support, particularly amongst the public, for any one policy that exceeds that kind of level of support. So here you do get a very clear and solid support, 66% support. On the opposing side, you have 27% who are opposed, so just over a quarter versus 2/3 who are supportive. That opposition is quite intense, with 20% saying they strongly oppose. And notably, that 27%, previously when we asked, first blush initial support for a new urgent care code, we discovered, I believe it was around 26% who said that they're opposed at the start. Oh, sorry, strongly opposed at the start. So we can see here that the stronglies have sort of stuck to their guns. They are still here, although they have moderated a little bit, with 20% still strongly opposed and 7% now moderately opposed, somewhat opposed. So now at this point in the survey, we take the membership through 4 key options where this additional $50 million could be allocated. And for each, we ask on a standalone basis whether or not they support allocating these funds to each of these options. The option that receives absolutely the most and nearly universal support is increased compensation levels for existing fee codes. You can see here 99% support it, 89% strongly support. That's what the dark 89% figure is. That's strong support. Almost nobody opposes it. 85% support appropriate compensation for providing reports to physicians or nurse practitioners, and within that, 58% are saying that they strongly support this. So these two are clearly the ones that get the options that get the highest support. Right behind that, but a distance behind the 85% figure is 65% who support the new urgent care code, as long as it has the mandatory elements that we discussed in the previous question. Still, in our world of research, 65% is a strong level of support. We don't often see support levels of 99% and 85%. Now, turning to the low vision code, this is interesting. This is an option that really isn't supported by the membership. 36% actually oppose it, so more oppose it than support it. So not an option that gets support here or any of the other questions within this survey. Now, what we did at this point in the survey is we did an exercise that is called pairwise. And what we do is we presented these 4 options that I just took you through, but we presented them in pairs so that you would see each option presented alongside each of the other options. So increased compensation levels for existing fee codes would be presented on screen with increased compensation for reports. Then on a separate question, it would be presented alongside the new urgent care code, and then in a separate question, it would be presented alongside the low vision code option. And in each of these pairs, we asked members to tell us which option they would most prefer the government allocate the additional $50 million in funding for OHIP-covered optometry services. This slide here tells you how many times, or what percentage times, each time that the item was presented, how many times it won. How many times was it chosen by members. And you can see that the increased compensation levels for existing fee codes wins that choice exercise almost every time, 94% of the time. The next two, which is the increased compensation for reports and the new urgent care code, they win this sort of choice exercise about the same amount. So 46% of the time the report option wins when presented, and 45% of the times that the new urgent care code is presented, it wins. The low vision code is almost never chosen over any of the others. So how do they stack up against each other within this exercise? And that's what this chart shows you. This chart should be read horizontally, so across the rows, and it tells you what percentage times the row item wins when shown alongside the others. So what is most interesting here for us is let's try and figure out who wins, or sorry, which one of these options wins the most when looking at the urgent care code versus the reports option. So if you look at the second row, urgent care code, and you look across to when it is presented against compensation for reports, you'll see the urgent care code is chosen 50% of the time when shown against compensation for reports. Similarly, when you see it elsewhere here, compensation for reports versus urgent care code, when it's presented first beside that, it's chosen 47% of the time, and the urgent care code gets the rest. So half the membership chooses one, half chooses the other. When presented on a standalone basis, both these options get very strong majority support, but when presented in a scenario where they have to choose between one or the other, the membership is split on which one to choose. But again, it's important not to lose sight of the fact that they're both very popular, very supported options. Now, we followed up this part of the exercise with a question about the existing fee codes, which is very good since that was overwhelmingly the top priority for members, was to increase compensation levels to existing fee codes. This question asks for some direction on which fee codes should get the most support, or sorry, get the most priority when increasing compensation in these fee codes. Now here, the dark blue in the bars is the percent saying that this code should get a major increase. The next blue segment of the bar, the sort of middle shade of blue, is the percent saying it should get a moderate increase. And the light blue part of the bar is those saying it should get a minor increase. The red shaded section is those who say it should not get an increase. It's not a priority for them to give an increase to this. So you can see across the board, no fewer than 87% say that each of these codes should get an increase. But what is most helpful for us is to sort of train our eyes to the dark bar, which is where they say this code should get a major increase. And in that regard, you can see 85% say that the V406 seniors code and the V409 adults code at 77%. These are the two top priorities for members in terms of increases. That is followed by the V402 seniors code, sort of in third place. And then you can see the rest. We have three coming in at roughly 55%, with the children codes at V404 and V402 trailing in terms of major priorities. When we ask members, just tell us, here are your options. Tell us which one is your top priority. You can only pick one. You can see this consistent with the previous slide. 76% choose the V406, 15% choose the V409, and the rest fall well below that. We then followed up with what we call an open-ended question, where respondents were allowed to type in their responses. And we asked them whether there were other suggestions about how or where they would prefer the government allocate some or all of the additional $15 million in funding for optometry services. What's come through loud and clear in this response is 72% said that there were no other areas or codes that they felt should receive the allocation. 12% basically continue the refrain that we heard in the previous slides, which is that we should increase fees. The fees do not cover costs. They haven't changed in a while. Let's increase those fees. And then the rest, no clear consensus, no clear lightning rods coming out here where there's one particular issue or policy option that is really getting members sort of coalesced around it. Nevertheless, we didn't know how many people would offer up a suggestion, so this was part of the survey where we only asked those who provided a suggestion, so not the 72% who said no other areas, the remainder. We asked them, okay, you provided a suggestion. How about you now tell us which of the following options, the 4 we previously presented, and your main suggestion in the open-ended question, which one is your top priority? And here you can see 76% still go with increased compensation levels for existing fee codes as their top priority. And the new urgent care code comes in at 5% and 2% for reports and 1% for a low vision code. Just 16% of those suggesting something in the previous question say that that would be their top priority. So some very clear results coming out of this in terms of priorities and preferences. And the survey, the good thing is we did put in that open-ended question to see if we were missing anything that was popular amongst the membership, and there is nothing really missing from the options that we tested. Very clear results here that it's increased compensation levels for existing fee codes as the far and away the top priority. We ended this section of the survey with some what we call impact testing. What we did was we re-asked these questions that we asked in the context introductory section of the survey. And we asked the membership if the government allocates the additional $15 million, at least partially in accordance with the wishes of the OAO membership, then how would you view the performance of the provincial government in terms of governing Ontario overall, in terms of managing healthcare in Ontario, and in terms of managing eye and vision care in Ontario? And you can see a sea change in perspectives of the government if this happens. You'll remember at the start of the survey, 70% said that the government was on the wrong track on each of these 3 factors. Now, we see changes to the positive. Now we have clear majorities saying that if they do this, they would view the government as being on the right track. 50% right track on governing overall, 63% right track on managing healthcare, and 71% right track in terms of managing eye and vision care in the province. You can see that these are switches or increases in the right track numbers of no less than a third. And in the case of eye care, it's an increase of 53% on the right track score. So clearly, it's not something to be overlooked. It's very clear that if the provincial government were to follow the direction from the OAO, that optometrists would have a much more positive and a clearly positive view of them. And how would they view the impact of having this $15 million allocated according to the membership's wishes? What would be the impact on the quality of care of eye and vision care in the province? And you can see here 66% think it'll be a major or moderate increase in the quality of care. Now that's largely a moderate increase, with 50% saying a moderate increase and 16% saying a major increase in the quality, but still very clear. Nobody thinks obviously that it would decrease, and only 31% have a neutral view and think that there would be no impact. So clearly 66% think it would improve the quality of care. Now at the end of the survey, we looked into some future advocacy options or initiatives just to gauge the membership and provide some direction to the OAO for their future activities. First, we asked whether or not there was support or opposition for establishing a mechanism for annualized increases to compensation within billing codes. Clearly, 96% support this, 80% strongly, and 17% somewhat. Clear, widespread support for this. And what about support and opposition for the various mechanisms that could be put in place? That's sort of the different types of ways of going about this. There's clear support, no less than 74% support for any one of these. So any one of these would do for members. But clearly the top two are the most popular, and that is either tying increases to the cost of living or tying increases to the inflation index. And is there support for removing the service of refraction as a required and OHIP insured element of the V409 code? And you can see the full question because it gets a little bit more detailed. We've put it down below in the gray box. Yeah, there is clear support for this, and it's quite intense. So 63% support it, 44% say strongly so. Now, I do just want to point out you have only 28% oppose. They do tend to be more intense in their opposition than moderate, with 19% saying that they strongly oppose. So there is a minority there who are opposed, but they're quite intense. I don't want that to overshadow the fact that you do have 63% support, and they are intense in their support as well, with 54% saying strongly support. But I don't want to overlook that group of opponents. And almost near the end of our survey, we then also tested a whole list of different advocacy options or initiatives that could be pursued in the future. And we asked the membership to indicate whether it was a major, moderate, minor, or not a priority at all. The dark blue bar, as we've seen in the previous slides, the dark blue bar indicates the percent who say it's a major priority, followed by the sort of middle shade of blue saying that's those who say it's a moderate priority. The lightest shade of blue is minor priority, and the red is those saying not a priority at all, so not really something they support. There's 3 of these options get some pretty strong support, no less than 88% saying it's at least a minor priority. But we like to look at the major priorities when we look at these rankings because they are the most instructive of where people sit and feel the most strongly about. So 73% say that establishing the mechanism for annualized increases should be the major priority or a major priority. Basing the V409 code on clinically significant or medically necessary cases that are determined by the optometrist, that has 44% saying it's a major priority. And obtaining clarity on uninsured services, 30% say that should be a major priority. The remainder of those tested don't have nearly as much, don't have nearly as many optometrists saying it's a major priority, no more than 15%. And you can see that they do have significantly higher segments who are saying this is not a priority at all for me. So in particular, the bottom 2 have 63% who say, so majorities who say it's not a priority. And almost half say that changing the eligibility of an uninsured comprehensive eye exam for older teenagers is not a priority for them. And we went through the exact same list and we asked members to tell us what is your one top priority. You can only choose one. What is it? The results are consistent with the previous slide. So clearly 2/3, they would like to see that mechanism for annualized increases. That is the top priority for the great bulk of the membership. 20% say changing the V409 code to be based on clinically significant medically necessary cases should be the top priority, but that trails considerably behind the annualized increase mechanism. We asked respondents another one of these open-ended questions where they get to type in their own response. We don't provide them with a list to respond to. It's just a big open box for them to type in their responses. And 80% said no other priorities or simply didn't respond, or they clicked the option to, there was an option to click, which was the no other priorities. And you can see that the remainder 20% don't coalesce around any one possible initiative. No more than 4% say anything. And you can see that, again, that the increasing the fees is in there again. Those are people who clearly feel strongly about it because they've already answered questions that gave them that as an option to respond to. And finally, we like to end these surveys with an open-ended question that invites members to provide any other thoughts or feedback about the survey, about the OAO, or any other issue, just to make sure we're not missing anything, and it's sort of an opportunity to consult and get feedback from the members on any issue that they feel strongly about, that they would like to share. I think it's really telling that here we had 80% not offer any additional input or comments. That tells us that this is a survey that really did sort of cover the field that it needed to in terms of our focus, and that there aren't any burning issues amongst the membership that are coming through. If there were, it would come through here. They would have typed it in here. They would have said, nobody has talked about this yet. I want you to address it. And that doesn't come through. We have 80% saying no additional input or comments or feedback, and the remaining 20% don't coalesce around a particular issue. And again, the top of these little issues that come behind, the very top is again those who say increase the fees. The fees have not increased. They're not covering costs. So that does bring us to the end of our survey slideshow presentation. And I just want to thank you for watching this and want to thank the OAO writ large for inviting us to conduct this survey on your behalf. We very much enjoyed the exercise, and we hope that this report and study is helpful to you in your endeavors. Thank you.